Hello everyone. Today we will see the working of sickle cell solubility test kit. The kit is by Biolab Diagnostics. Now let us have a look at the kit components. There are two bottles of sickle's R1 reagent and two bottles of sickle R2 reagent. We also have rubber caps, alcohol swabs, lancets, test tubes for 50 tests, sickle reader, blue tips, white tips, 20 microliter sample pipette, instructions for use or literature, and 2 ml dropper for reagent. Now before performing the test, let us have a look at the preparation of working reagent. Transfer the powder from R2 bottle to R1 bottle. Mix well and make sure all the powder has been transferred. Label the date of preparation of this working reagent. It is stable for 15 days at room temperature and 6 months at 2 to 8 degrees. For the procedure, take 2 ml of working reagent in the test tube. Collect 20 microliters of patient blood sample in the tube and wait for 10 minutes. After 10 minutes, if you cannot see the background lines, it can be concluded that the patient is sickle cell positive. If the background lines are visible, the patient is negative. Kindly note that if the patient is having very low hemoglobin, use 40 microliters of blood sample instead of 20 microliters of blood. Now, as explained, we will mix the powder from R2 bottle to R1 bottle. Mix well and make sure all the powder has been transferred. You may put some liquid back to R2 bottle to ensure there is no powder left. Mix thoroughly to ensure that the powder dissolves homogeneously. Now wait for 15 minutes. As you can see, we have labeled the date of preparation of working reagent. This can be stable at room temperature for 15 days or it can be kept in 2 to 8 degrees for 6 months. Now take the test tube in the reader for performing the test. Put 2 ml of the working reagent that was prepared using a dropper for both the samples. We are going to use two samples over here. Now use 20 microliter pipette for the patient sample. You can use a 20 microliter dropper as well in place of the pipette. Make sure to wipe the tip by a tissue paper. Close the tube by a rubber cap and mix it well by inversion. We are using 20 microliters of blood sample over here. But if the patient is having low hemoglobin, Make sure to use 40 microliters or 2 drops of blood sample. Keep this mixture for 10 minutes. As you can see, we have mixed it thoroughly by inversion. Now we will start the stopwatch and set it for 10 minutes. Because of the longer duration, we can even catch weak positive patients. On the left-hand side, background lines are clearly visible, which concludes that the patient is negative. However, on the right-hand side, the solution is hazy, which means that the patient is positive. This completes the test. A positive result may be confirmed with HB electrophoresis. Now we will see how to perform a test using finger prick. We have taken a new test tube and put 2 ml of working reagent in it, same as before. Use an alcohol swab before pricking finger. Now use a lancet for pricking. Take 20 microliters of blood sample using the pipette or the dropper and mix it with the working solution and keep it for 10 minutes as per our procedure. Kindly ensure to close the cap and mix it thoroughly. Now we will wait for 10 minutes. Once this is done, you can see the background lines are visible in this case and it can be concluded that the patient is negative. Thank you.